The skeleton consists of 206 bones that are spread across two major divisions, the axial division and the appendicular division. The axial division forms the central axis of the body. It functions to protect the brain, the spinal cord, the heart, and the lungs, and it also provides attachment sites for the muscles that move the head, the neck, the thorax, and the abdomen. The appendicular division consists of the bones of the upper and lower limbs, in addition to the pectoral girdle and the pelvic girdle. The girdles function to attach the limbs to the axial skeleton. Specifically, the pectoral girdle attaches the upper limbs to the axial skeleton, and the pelvic girdle attaches the lower limbs to the axial skeleton. Here, our focus will be on the axial skeleton. The axial skeleton contains 80 bones in adults, and these are the bones that are found along the midline of the body. The axial division consists of the skull, which contains 22 bones, the vertebral column, which contains 26 bones, the ribs, which there are 24 in total, a single sternum, a hyoid bone, which is the bone that is located within the throat near the larynx, in addition to 6 middle ear ossicles, 3 per ear, which function to connect the tympanic membrane or the eardrum to the sensory structure of the inner ear. The skull is the skeletal structure of the head. It consists of 22 bones, with the skull bones being divided into 2 major functional groups. We have the cranial bones, or the brain case, which function to surround, support, and protect the brain. And then we have the facial bones, which give structure to the nasal cavity, the eye sockets, which are also called the orbits, and the facial bones also support the teeth. The cranial bones consist of the frontal bone, which is anteriorly located, the parietal bones, which are laterally and superiorly located, the temporal bones, which are laterally and inferiorly located, the occipital bone, which is the posterior and inferiorly located bone, the ethmoid bone, which is internally located between the cranial cavity, which houses the brain, and the nasal cavity. And then finally we have the sphenoid bone, which is internally located at the back of the orbits. From an anterior view of the skull, we can see the frontal bone, which forms the anterior and superior aspect of the skull. The parietal bones are located on the lateral sides of the skull, just behind the frontal bone. We can also see the sphenoid bone, which is located at the back of the orbits or the eye sockets. The temporal bones form the lateral sides of the skull. And we also see that part of the ethmoid bone forms the wall between the eye socket and the nasal cavity. From a lateral perspective, we have a much better view of the parietal and temporal bones. Here we can also see the occipital bone, which forms most of the posterior and inferior aspect of the skull. The frontal bone, once again, at the anterior aspect of the skull, is visible from this side. We also see part of the sphenoid bone in addition to part of the ethmoid bone here. From an inferior viewpoint, the underside of the temporal bones are visible, in addition to the majority of the occipital bone, which composes much of the base of the skull.